Morning students, here we can see some of the nursing management is in early pregnancy, and first of all this is only for an exam purpose, not for anything. The fourth year BSc nursing students who are planning to write the exams, they can learn and write. It's not an other, it's just I referred books and I made this one, so please go through this. First one is imbalanced nutrition, less than body requirement related to morning sickness and heartburn and lack of knowledge of requirement of pregnancy. They encourage women to eat low fat protein foods and fat dry carbohydrates, just toast and crackers, and encourage the woman to eat small frequent meals, advise the woman to eat slowly, instruct the woman to avoid brushing her teeth soon after eating, instruct the woman to get out of bed slowly. Encourage the woman to drink soups and liquids between meals to avoid stomach distension and dehydration. Instruct the woman in the use of antacids. Caution against use of sodium bicarbonate because it results in the absorption of excess sodium and fluid retention. Instruct the woman to avoid offensive foods or cooking orders that may trigger the nausea. Encourage the woman to eat few bites of soda cracker or dry toast before getting out of the bed in the morning. Teach women the importance of good nutrition for herself and for the fetus. Review the basic food groups with appropriate daily servings. 7 servings of protein-rich foods, including 1 serving of a vegetable protein, 3 servings of a dairy products or other calcium-rich foods, 7 servings of grain products, 2 or more servings of vitamin C-rich vegetable or fruit, 3 servings of other fruits and vegetables, 3 servings of unsaturated fats, 2 or more servings of other fruits and vegetables. If the woman is a vegetarian, inform her appropriate intake. Assess the type of vegetarian and food intake. There are two broad vegetarians, that is traditional or cultural or religious affiliation prescribe their diet. Second, new adopted vegetarian dietary patterns as a personal philosophical choice. The subgroups exist within this group are vegan, they eat no animal foods, lacto, eat milk, dairy products but eat no meat, poultry, fish, seafood or eggs, lacto-ovo, eat milk, dairy products and eggs but eat no meat, poultry, fish or seafood. Partially vegetarians may exclude specific type of animal food, usually meat, but may consume fish and poultry. The recommended iron and folic acid supplements. And inform the woman to have an average weight gain in the pregnancy is about 11 to 16 kg, about zero point 0.9 to 2.3 kg are gained the first trimester, about 0.5 kg per week for the remainder of the gestation. Average weight gain for the obese woman is 6.8 kg. Adolescent weight gain should be about 15 pound more than that of adult woman if within the 2 years of starting menses. Women with multiple pregnancies should gain between 16 to 20 kg. Average weight gain for underweight women is 13 to 18 kg, that is assessed for any cultural or religious times of fasting, example Lent or Ramadan. Advise women to limit the use of caffeine. Inform the woman that alcohol should be limited or eliminated during pregnancy. No safe level of intake has been established. Inform the woman that smoking should be eliminated or severely reduced during pregnancy. Risk of spontaneous abortion, fetal death, low birth weight, and neonatal death increases with increased level of maternal smoking. Inform the woman that ingesting any drug during pregnancy may affect fetal growth and should be discussed with her healthcare provider. Second, activity intolerance related to physiological changes of pregnancy and enlarging uterus. Teach the woman in reasons of fatigue and have a plan for a schedule for adequate rest. Fatigue in the first trimester is due to increased progesterone and effect on the sleep center. Fatigue in the third trimester is mainly to be carrying increased weight of the pregnancy. About 8 hours of rest are needed at night. Inability to sleep may be due to excessive fatigue during the day. In the later months of pregnancy, sleeping on the side with a small pillow under the abdomen may enhance comfort. Frequent 15 to 30 minutes rest period during the day are important to avoid overfitting. Whenever possible, women should work while sitting with her legs elevated. Women should avoid standing for a prolonged period, especially during the third trimester. To promote placental perfusion, women should not lie flat on her back. Left lateral position provide the best placental perfusion. However, either side is acceptable. Help the woman to plan adequate exercise if not contraindicated. General exercise during the pregnancy should be keeping with the woman's pre-pregnancy pattern and type of exercise. Activities or sports that have high risk of bodily harm like skiing, snowmobiling, ice skating, inline skating, horseback riding should be avoided. During pregnancy, endurance during the exercise may be decreased. Exercise classes for pregnant women that concentrate on toning and stretching have resulted in enhanced physical condition, increased self-esteem, and greater social support as a result of being the exercise group. Relative contraindication to aerobic exercise during pregnancy include severe anemia, unevaluated maternal cardiac arrhythmia, chronic bronchitis, poorly controlled type 1 diabetes, hypertensive disorder, social disorder, hyperthyroidism, extreme morbid obesity, extreme underweight, history of extremely sedentary lifestyle, intrauterine growth restriction in current pregnancy, orthopedic limitation, or a heavy smoker. Third, reducing anxiety and fear, promoting preparation for labor, delivery, and parenthood. Encourage the women for the couple to discuss their knowledge, perceptions, cultural values, and expectations of a labor and delivery process. Provide information on childbirth education classes and encourage them to attend. Provide information on sibling and grandparent preparation is an indicator. Encourage a tour to health birth facility. Discuss coping and pain control technique for labor and birth. Inform the woman or couple of common procedures during labor and birth, provide guidelines for coming to the birth facility, encourage women or couple to discuss their perceptions and expectations of parenthood and the idealized child, discuss infant sleeping, eating, activity, and response patterns for the first month of life, discuss physical preparation for their infants, such as sleeping space, clothing, feeding, changing, and bathing equipment. Discuss plans for returning to the work and childcare arrangement. Discuss the importance of planning time for themselves and for other apart from the neonate. Provide information and encourage attendance by baby care, breastfeeding, and parenting class. Answer any questions the woman or the couple may have. High risk for the fluid volume deficit related to impaired intake or excessive loss that by vomiting. Objectives: identify the practice measures to reduce vomiting, intake of individually appropriate amounts of fluid daily, identify the signs and symptoms of dehydration necessitating treatment. Nursing action include determine the frequency of vomiting, review the history for other possible medical problems like peptic ulcer, instruct the client to maintain daily intake output, assess the skin temperature for and turgor, mucous membrane, urine specific gravity, encourage increased intake of carbonated beverages. High risk for constipation related to the smooth muscle relaxation, increased absorption of water from GI tract, presence of hemorrhoids, ingestion of iron supplements. Objectives: maintain a normal pattern of bowel functioning, identify the individual contributing factors for risk behavior. Nursing actions include determine a pre-pregnancy elimination habits, noting the alterations with pregnancy, assess for hemorrhoids, provide dietary information regarding fresh fruits, vegetables, grains, fiber, roughage, and adequate fluid intake. Encourage regular non-strenuous exercise programs such as walking. Discuss cautious use of stool softener if the diet or exercise is not effective. Instruct the woman to increase the fluid intake to at least 8 glasses of water per day. 1 to 2 quarters of fluid per day is desirable. Teach the woman that foods high in fiber should be eaten daily. Encourage the woman to establish regular patterns of elimination. Encourage daily exercise such as walking. Inform the woman that over-counter laxatives should be avoided and bulk forming agents may be prescribed if indicated. High risk of urinary tract infection or urinary stasis, poor hygienic practice, and insufficient knowledge to avoid exposure to pathogens. Objectives include identify behaviors to reduce urinary stasis, list the signs and symptoms of recurring evaluation, be free of signs and symptoms of infection. Nursing actions include provide information about signs and symptoms of UTI, stress the need of reporting these to the healthcare giver and avoid self-medication, stress the need of frequent hand washing before meals and food handling and before after toileting, provide information about other hygiene measures including wiping vulva from front to back after urinating, instruct the client to drink 6 to 8 glasses of fluid per day, discuss the role of an acid residue in diet and addition of orange juice, encourage the practice of Kegel exercise, just the 2 use of cotton underwears, obtain a routine urine sample for microscopic examination, pH, and presence of WBC. Knowledge deficit may be related to progress of pregnancy and regular antenatal checkup. Fetal well-being, the progress of pregnancy, provide information regarding normal physical, physiological associated with pregnancy. Evaluate the client's knowledge and cultural beliefs regarding normal physical and physiological changes of pregnancy. Clarify misconceptions, maintain open attitude towards the beliefs of the client, determine the attitude of the client towards care given. Sorry. Discuss the fetal development using pictures, answer the questions about infant care and feeding. Regular antenatal visit, insist the importance of ANC and tell the client frequency of ANC. Teach the client usual procedures done in each ANC. Fetal well-being, discuss the fetal development using pictures, teach the client regarding quickening, instruct the client the importance of USG during antenatal period, educate the regarding the normal pattern of weight gain during pregnancy. Thank you. Thank you for listening.